Really quickly, I wanted to introduce there are a lot of differential diagnoses to consider in your patients that are presenting for facial erythema. This by no means is an exhaustive list, but it's pretty comprehensive. It's divided up, they're grouped into different categories, starting with primary inflammatory skin diseases, then moving into diseases that are caused due to external factors, photosensitive disorders, systemic disorders, infectious presentations of facial erythema. There are some localized inflammatory infiltrates that can also cause facial erythema. And then there's this big grouping of other.
So when we think about our natural antimicrobials, one of the first one that comes up in a lot of research, and of course a lot of people already know about, is Melaleuca alternifolia, or tea tree. And this plant grows mostly in Australia. So for the most part, what we're using is a tea tree volatile or essential oil that was made there and shipped over to the States or Canada, or other places in the world. And tea tree oil is a really potent antiseptic, really. So it can work against a lot of bacteria and fungi as well. And you'll find in a lot of products that patients may be using already over the counter. It's in soaps, face washes, creams, etc. There's quite a few trials on this, actually.
So green tea is another natural antimicrobial. There are catechins in green tea. Really commonly, you'll see those extracts referred to as EGCG for short. It's a really potent antioxidant, anti-inflammatory, and it has antimicrobial properties. Oral isotretinoin therapy, again, it's something to mention as it's indicated in really severe recalcitrant disease, as I showed that picture of acne conglobata. The doses for acne range from about 0.5 milligram to 1 milligram per kilogram per day. Patients have to have, you want to get liver function tests on patients before starting them on oral isotretinoin therapy and monitor liver function tests as they are continuing to take the therapy. If you start to see a severe increase in liver enzymes, that's a sign that they're not tolerating the therapy well, and it probably needs to be discontinued.
So we have the green tea here again, Camellia sinensis. We have Serenor repens, which is saw palmetto, and used a lot for prostate conditions, but it's certainly appropriate in our patients of any gender with acne. In particular, I would say in those patients with adult acne who are women. So there are a lot of diseases or conditions associated with rosacea. Cardiovascular disease. We see a higher prevalence of cardiovascular risk factors like dyslipidemia or high lipids, high blood pressure, and even coronary artery disease. There's a strong association with gastrointestinal conditions, and we're going to talk quite a bit about that. But in particular with celiac disease, Crohn's disease, ulcerative colitis, and IBS, and of course a common cause of IBS, which is SIBO or small intestinal bacterial overgrowth.